Searching for evidence. Once a patient-client-centered clinical question is formulated, it is important to plan a general strategy for a search before delving into the various sources of evidence available. The following 5 steps are recommended as a starting point. Number 1. Determine which database will be most useful. An enormous variety of sources are available through which a physical therapist may search for evidence, many of which are available throughout the internet. As these electronic databases have proliferated, their focus areas have evolved. Some are broad-based and cover any type of background or foreground question. Example, Medline, PubMed. Others only focus on specific elements of patient-client management, such as interventions. For example, the Physiotherapy Evidence Database, PEDRO. Most databases lists citations of individual original works. Example, Cumulative Index to Nursing and Allied Health Literature, CINAL. Whereas others provide syntheses or reviews of collections of research articles. For example, National Guideline Clearinghouse. Some only address questions specific to physical therapists, patient-client management. For example, Hooked on Evidence. Others cover a wider range of medical and allied health topics. Example, Cochrane Library. Familiarity with options will help a physical therapist select a database that will provide citations for evidence about the clinical question in an efficient manner. Readers may be tempted to use more general web-based search engines such as Google Scholar, scholar.google.com, or Yahoo Education, because they are familiar to frequent web users. These types of services have a user-friendly feel to them and have evolved over the last several years to mimic traditional scholarly databases. In addition, recent studies have demonstrated that citation identification accuracy is comparable or better than that of more traditional biomedical search engines. However, they are general search engines. Google Scholar and other similar services are not designed to search efficiently through a designated collection of resources devoted to medical or physical therapist practice. In addition, they do not have clinically relevant search features, such as the ability to restrict the search according to the patient with which they have been cited by other authors. Restrict the search according to patient characteristics or type of research design. They also often rank articles according to the frequency with which they have been cited by other authors, which may be a bias to the information that they have provided away from contemporary works with newer information. These limitations mean that evidence to answer a question may be missed, or that irrelevant information may be returned. Finally, they may or may not provide access to online journals in which the evidence is published. As a result, evidence-based physical therapists should spend the time necessary to learn the features of the databases described in this chapter and save Google and Yahoo for other types of searches. Number 2. Identify search terms to enter into the database. All electronic databases and search engines require input from the user to start the search. The most common form of input is a keyword or search term that will be used to identify relevant information. In evidence-based physical therapist practice, the keywords are derived directly from The clinical question of interest. Considering the following example. Does age and prior functional status predict discharge to home following inpatient rehabilitation for a fractured hip in a 92-year-old woman? Possible keywords from these questions include age, functional status, predict, discharge, home, inpatient, rehabilitation, fracture, hip, and woman. Additional terms may be used to reflect concepts in the question such as function instead of functional status and elderly in place of 92-year-old. Finally, some of the words may be combined into phrases such as inpatient rehabilitation and hip fracture to provide a more accurate representation of the question's content. The challenge is to determine which combination of these keywords and phrases will produce the most efficient search string. One option is to start simply by using few words or phrases, such as predict, discharge, hip fracture. This approach may improve the chances of identifying a wide variety of evidence because of the general nature of the terms. However, the question addresses specific predictive factors, namely age and prior functional status in an elderly woman. The second option, therefore, is to include more keywords or phrases to narrow the search to evidence directly addressing the question. In addition to these decisions, therapists also should consider other synonyms that may be useful or necessary to enhance the search. Relevant synonyms in this example include femur for hip and female for woman. Synonyms come in handy when a search for evidence returns no citations. Evidence-based healthcare databases usually have specific keyword vocabularies or index terms that are used to build queries. Familiarity with these vocabularies is essential to optimize the efficiency of the research. Number 3. Use search configuration options to streamline the process. Every electronic database and search engine has rules that determine which words it will recognize and what letter size, case, and punctuation must be used when entering search terms. Words such as and, or, not, and near, collectively referred to as Boolean operators, are used universally to create such term combinations. Configurations options also include method to limit or to expand the search. Search filters may include language, publication dates, type of research design, and search bases such as keyword, author, or journal name. Choices might also be available regarding the number of search terms to a minimum because the search function is programmed to work within the specified parameters. Finally, a method for including synonyms or related terms referred to as exploding the search term usually is available. Some electronic databases and search engines make these rules and choices apparent by the way that they format their search pages. Others require some effort to hunt for the information through the search help features. In either case, spending some more time on the front end learning these details will save time and frustration during the search. Number 4. Be prepared to reformulate the question. A common problem during an evidence research search is either excessive numbers of citations or hits, or none at all. When this situation happens, the first thing to do is go back to the database features and determine if there are additional options to narrow or expand the search. Keyword and phrase substitutions also may be required. If these approaches are unsuccessful, then it might be time to revise the question. Consider the following example. Which is more effective? For symptom management, aquatic or land-based exercise in a middle-aged man with joint pain? Too many hits using keywords from this question likely indicate that the question is too broad. There are several options for revising the question into a more precise form, including use of a more specific diagnostic test, labels such as degenerative joint disease or rheumatoid arthritis, adding more specific details about the patient client such as his age, or using a more specific outcome such as pain relief. A revised question might read, which is more effective for pain relief? Aquatic or land-based exercise in a 58-year-old man diagnosed with rheumatoid arthritis. In contrast, too few hits may indicate that the question is too specific or that no evidence is yet available to answer it. In that case, a broader question may be useful, such as, is exercise effective for pain relief in a man with arthritis? Keep in mind that as questions become more general, there's a greater chance that the evidence located will contain information that is not directly related to the current situation. For example, subjects in a study may be older than the patient, or the intervention may be a home walking program rather than a program supervised in the clinic. In these situations, physical therapists must use their clinical expertise and judgment to determine whether the study is relevant and whether there is enough in common between the patient client and the subject studied to extrapolate the results to this specific situation. In extreme cases, there may be difficulty finding any physical therapy related evidence for a patient client's disease, disorder, or need. Physical therapy management of the sequelae of a heart disease is a common example of such a situation. In these instances, it might be helpful to search for evidence that includes providers other than physical therapists. For example, exercise physiologists, nurses. Once again, clinical expertise and judgment will be required to determine if it is safe and appropriate to extrapolate and apply any findings from this general evidence to the physical therapist management of an individual patient client. Number 5. Aim for the highest quality evidence available. The two general sources of evidence are described as primary and secondary. Primary sources provide individual original research reports via peer-reviewed journals and websites, theses and dissertations, and proceedings from professional meetings. Secondary sources such as textbooks, summaries on websites, and review papers contain information based on their primary sources. Traditionally, primary sources of evidence have been preferred because they provide the original works about which the physical therapist can make an independent critical appraisal. As evidence about clinical questions has expanded, however, the ability to draw more accurate and precise conclusions based on a collection of individual studies has become possible. Individual and collaborative groups of researchers as well as professional societies have developed summaries and systematic reviews of individual literature. These secondary sources of evidence are valued because of comprehensive and rigorous methodology used to search for, select, and appraise original works about a particular topic. They have the added benefit of reducing the time a busy clinician may spend trying to locate the best available evidence. Evidence hierarchies have been developed to expedite the process of identifying high-quality evidence from primary and secondary sources.